Physical well-being. Physical well-being refers to a state of optimal health and fitness, encompassing both the body's physical capabilities and overall sense of well-being. It involves maintaining healthy habits and lifestyle choices that promote good health and prevent disease. Key components. Nutrition: consuming a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Exercise: engaging in regular physical activity, such as cardio, strength training, or yoga. Sleep: getting adequate sleep, 7 to 9 hours per night, to allow the body to rest and repair. Weight management: maintaining a healthy body weight through diet and exercise. Substance use: avoiding or limiting alcohol, tobacco, and drug use. Medical checkups: regularly visiting a healthcare professional for preventive screenings and checkups. Benefits: reduced risk of chronic diseases, example heart disease, stroke, cancer. Improved mood and mental health. Increased energy levels and stamina. Enhanced physical performance and agility. Reduced stress and anxiety. Improved overall quality of life. Promoting physical well-being. Establish healthy eating habits and make informed food choices. Find physical activities you enjoy and stick to a regular exercise routine. Prioritize sleep and create a relaxing bedtime routine. Manage stress through techniques such as exercise, meditation, or yoga. Consult a healthcare professional for guidance on weight management, substance use, and medical checkups. Remember, physical well-being is a journey, not a destination. By making consistent lifestyle changes and taking care of your body, you can achieve and maintain optimal health and well-being. What is physical well-being? Physical well-being is the ability to maintain your body's health and function, allowing you to perform daily activities without undue fatigue or stress. It involves adopting healthy habits such as regular exercise, proper nutrition, adequate sleep, good hygiene, and making responsible choices about substance use. By caring for your physical health, you not only prevent illness and injury but also positively impact your emotional and intellectual well-being. Key components of physical well-being. Exercise and movement. Regularly moving your body through activities you enjoy, like walking, yoga, or dancing, helps maintain strong muscles, bones, and a healthy heart. Nutrition. Eating balanced meals with fruits, vegetables, and whole grains provides the body with the nutrients it needs to function optimally. Sleep and rest. Getting enough quality sleep is essential for the body to repair itself and prepare for the next day, with most adults needing 7 to 9 hours per night. Preventative care. Scheduling annual check-ups with healthcare providers and taking preventative measures like vaccinations helps catch and treat potential issues early. Avoiding harmful habits. Making conscious decisions to limit or avoid substances like alcohol and tobacco, and practicing safe sex, are important aspects of physical wellness. Self-care. Recognizing your body's needs, even for simple things like hydration and taking breaks, and taking appropriate action when you feel unwell, contribute to overall physical health. Stress management. Finding healthy ways to cope with and reduce stress is crucial, as prolonged stress can negatively affect your physical health. How to improve physical well-being. 10 ways to improve your physical health. Loving life. To improve physical well-being, consistently engage in physical activity, maintain a balanced and nutritious diet, prioritize sufficient sleep, manage stress, and limit alcohol and tobacco use. Staying hydrated, getting regular health check-ups, and avoiding toxic substances are also important for overall physical health. Nutrition. Eat a balanced diet. Focus on fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Limit unhealthy foods. Reduce your intake of foods high in salt, added sugars, and harmful fats. Stay hydrated. Drink plenty of water throughout the day. Physical activity. Move more, incorporate more physical activity into your daily routine. Aim for 2.5 hours a week. Break this down into smaller, manageable amounts of time, such as 20 to 30 minutes daily. Variety of exercises. Engage in aerobic activities like brisk walking, cycling, or swimming, and consider strength exercises like push-ups, squats, or weightlifting. Sleep. Get enough sleep. Adults generally need 7 or more hours of sleep per night. Establish a routine. Go to bed and wake up around the same time each day to improve sleep quality. Mental well-being. Manage stress. Use techniques such as deep breathing, meditation, yoga, or engaging in enjoyable activities to help lower stress levels. Connect with others. Build a supportive community of friends and family, as this contributes to self-healing and overall well-being. Avoid harmful substances. Don't smoke or vape. Avoid all tobacco products. Limit alcohol. Drink alcohol only in moderation, if at all. Avoid drugs. Do not use illegal drugs or use prescription medications in ways other than prescribed. Preventative care. Regular check-ups, keep up with regular health appointments, screenings, and vaccinations. What are some examples of physical well-being? Examples of physical wellness include eating nutritious foods, getting regular exercise, prioritizing sufficient sleep, managing stress, maintaining personal hygiene, avoiding harmful substances like excessive alcohol or tobacco, practicing safe sex, and attending routine medical checkups and screenings. These habits work together to keep the body healthy, resilient, and energetic. Here's a breakdown of examples. Diet and hydration. Eating a balanced and nutritious diet. Staying hydrated by drinking enough water throughout the day. Listening to your body's hunger cues and eating foods that make you feel good. Physical activity. Engaging in regular exercise, such as walking, running, swimming, dancing, or yoga. Finding ways to be active that you enjoy. Taking time to move your body daily. Sleep and rest. Prioritizing adequate sleep, aiming for at least 6 to 7 hours for the average adult. Resting when you need it. Maintaining healthy sleep routines. Safety and prevention. Avoiding harmful habits and substances, such as excessive alcohol, smoking, and unnecessary drug use. Practicing safe sex to prevent sexually transmitted infections and unplanned pregnancies. Seeking routine, preventative medical care and screenings. Practicing good personal hygiene. Using safe modes of transportation. Mindfulness and self-care. Managing stress effectively through relaxation techniques. Recognizing signs of illness and responding appropriately to your body's needs. Taking active steps to learn about and advocate for your own physical health. Can stress impact physical well-being? Stress symptoms can affect your body, your thoughts and feelings, and your behavior. Knowing common stress symptoms can help you manage them. Stress that's not dealt with can lead to many health problems, such as high blood pressure, heart disease, stroke, obesity, and diabetes. What are 10 benefits of physical activity? Top 10 benefits of regular physical fitness center attendance. 10 benefits of regular physical activity include improving mental health by reducing stress and symptoms of depression, enhancing sleep quality, strengthening bones and muscles to prevent osteoporosis and falls, managing weight to combat obesity, reducing the risk of chronic diseases like heart disease and type 2 diabetes, boosting the immune system, improving energy levels by enhancing cardiovascular function, promoting healthy aging by maintaining brain function and physical ability, improving mood and self-esteem, and increasing your chances of living a longer life. Here is a more detailed list of the benefits. 1. Boosts mental health. Improves mood. Physical activity releases brain chemicals that can improve your mood and make you feel more relaxed. Reduces stress and anxiety. Exercise can help manage stress and reduce feelings of anxiety. Combats depression. Regular physical activity is linked to a lower risk of depression. 2. Improves sleep. Regulate sleep patterns. Exercise helps regulate your body's circadian rhythm and makes you more tired at bedtime, leading to better, more restful sleep. 3. Strengthens bones and muscles. Increases bone density. Impact exercises like running or gymnastics can help promote higher bone density. Builds muscle. Strength training increases the workload on your muscles, helping your body build and repair muscle tissue. 4. Aids in weight management. Controls weight. Physical activity, combined with a healthy diet, plays a vital role in managing body weight and preventing obesity. 5. Prevents chronic diseases. Reduces heart disease risk. Exercise strengthens your heart and improves your overall circulation. Manages blood sugar. It helps your body better manage blood sugar levels and insulin, lowering your risk of type 2 diabetes. Lowers cancer risk. Regular activity can reduce the risk of certain cancers, including colon, breast, and lung cancer. 6. Boosts energy levels. Increases stamina. By improving your cardiovascular and lung health, exercise increases the efficiency of your heart and lungs, leading to more energy and less fatigue. 7. Promotes healthy aging. Maintains brain function. Physical activity can keep your thinking, learning, and judgment skills sharp as you age. Prevents falls. Strengthening muscles and improving balance helps reduce the risk of falls. 8. Enhances immune function. Supports immunity. Physical activity can act as a powerful immunization, fending off various illnesses and bolstering your immune system. 9. Improves joint health. Reduces stiffness. Consistent exercise can help rehydrate cartilage and maintain strong muscles around joints, reducing pain and stiffness. 10. Increases longevity. Promotes a longer life, by reducing the risk of chronic diseases and improving overall physical and mental health. Regular physical activity increases your chances of living a longer, healthier life. What are the 5 ways to well-being? Physical activity. Being active and moving your body helps you keep fit and healthy, both mentally and physically. Find ways to be active like taking a walk, dancing, doing some yoga or playing a sport or game. Some other activities you could try: go for a walk, run, swim or ride. What are the signs of poor well-being? Common signs and symptoms include drop in functioning, problems in concentration, logical thought, and speech, loss of desire to participate, increased sensitivities, decline in personal care, mood swings, changes in sleep and appetite, unusual and odd behavior, anxiety, behavioral shifts like changes in eating or sleep habits, and a general feeling of exhaustion. Here are more details on these signs. Physical symptoms: headaches, muscle aches, or tension in the neck and shoulders. Digestive issues, like stomach aches, nausea, or changes in bowel movements. Fatigue and low energy, that doesn't improve with rest. Increased heart rate, or feeling chest tightness. Sleep disturbances, such as difficulty falling or staying asleep. Cognitive, thinking, symptoms. Trouble thinking clearly, or concentrating. Forgetfulness, or memory problems. Inability to make decisions, or solve problems. Constant worry, or negative thinking. Emotional symptoms. Feeling overwhelmed, or unable to cope. Irritability, or being easily upset. Nervousness or anxiety. Apathy or feeling indifferent to hobbies and activities. Changes in mood, such as feeling lonely or unhappy. Behavioral symptoms. Changes in eating habits, such as overeating comfort foods or loss of appetite. Increased use of alcohol, tobacco, or drugs. Isolating oneself from others or difficulty interacting with loved ones. Procrastination, or inability to finish tasks. General feeling of exhaustion. Persistent exhaustion, and constant tiredness. Feeling drained or that you have lack of energy. Why am I always in fight or flight mode? What is the fight or flight response? You may feel stuck in fight or flight mode due to chronic stress from events like abuse, violence, or financial hardship, as well as underlying conditions such as anxiety, PTSD, or genetic predispositions that cause your nervous system to overreact to perceived threats. This can become a habitual response, making you feel on edge even when there's no immediate danger. Causes of a persistent fight or flight response. Chronic stress, ongoing stressors, even if not life-threatening, can keep your body in a heightened state of alert. Traumatic events, past experiences of abuse, neglect, or violence can trigger a strong and prolonged stress response. Mental health conditions, anxiety, panic disorder, and post-traumatic stress disorder, PTSD, can all cause an overly sensitive fight or flight reaction. Life experiences. Certain professions like military or law enforcement, or even being involved in a major accident, can increase your risk of a heightened stress response. Genetic factors. Variations in genes that control the body's stress response can influence how an individual reacts to stressful situations. What you can do. Seek professional help. Consulting a doctor or mental health professional is crucial to identify the underlying cause and receive appropriate guidance and treatment. Manage stress. Learn stress management techniques to help calm your body's response. Understand your triggers. Work on identifying situations, people, or places that activate your fight or flight response. Engage in healthy activities, regular exercise, a healthy diet, and engaging in positive hobbies can help reduce your overall stress levels. What are 8 positive benefits of physical activity? Benefits of exercise, Medline Plus. What are the health benefits of exercise? Help you get to and stay at a healthy weight. Reduce your risk of heart diseases. Help your body manage blood glucose, blood sugar, and insulin levels. Help you manage a chronic health condition. Help you quit smoking. Improve your mental health and mood. How do you know your body is not well? Signs that your body may not be well include a persistent fever, unexplained weight loss, significant fatigue, changes in bowel habits, recurring infections, new moles or skin lesions, or numbness and tingling in the hands and feet. Other concerning symptoms can include shortness of breath, unexplained swelling, severe dizziness, blood in your stool, or a rash that doesn't fade. If you experience any of these symptoms, it's important to consult a doctor for a proper diagnosis and treatment. General signs of not feeling well. Fatigue and malaise. Feeling persistently tired, weak, or a general sense of unease can indicate you're run down or not getting enough quality sleep. Changes in bowel habits. New or persistent constipation, diarrhea, or blood in your stool can be signs of an underlying issue. Headaches and muscle/joint pain, while common, recurring or severe headaches and persistent muscle or joint pain can signal a more serious problem. Concerning physical symptoms. Fever. A persistent or recurring fever, especially one accompanied by night sweats or other infection signs, warrants a doctor's visit. Unexplained weight loss. Significant unintentional weight loss can be a symptom of malnutrition or a more serious underlying condition. Skin changes. Look out for new moles or growths, changes in existing moles' shape, size, or color, or skin lesions that don't heal. Swelling. Swelling in the legs or other areas without a clear injury can signal heart, kidney, or liver issues. Numbness or tingling. Tingling or numbness in your extremities, particularly if it starts in the legs and moves up, can be a sign of nerve problems. When to seek immediate medical attention. Severe symptoms. Seek emergency care for symptoms like confusion, severe headache, difficulty breathing, or a rash that doesn't disappear when pressed. Unusual bleeding. Any unexplained or unusual bleeding is a serious sign that requires immediate medical attention. Severe pain. Sudden, severe, or recurring abdominal pain should be evaluated by a medical professional right away. When to contact your doctor. Chronic symptoms. if you experience frequent heartburn, recurring infections, or a persistent high temperature that lasts for several days, consult your doctor. Wounds that won't heal. Sores or wounds that fail to heal are a sign that you should see a healthcare provider. Other symptoms. Any significant change in your body's function or a symptom that concerns you should be discussed with a doctor. This is for informational purposes only. For medical advice or diagnosis, consult a professional. AI responses may include mistakes. What are 10 healthy habits? 10 healthy habits for kids, Moss.Health. 10 healthy habits include, eating a balanced diet with plenty of fruits and vegetables, staying hydrated by drinking water, getting regular exercise, prioritizing quality sleep, managing stress through mindfulness and relaxation, limiting screen time, nurturing positive relationships, practicing gratitude, ensuring good dental hygiene, and getting regular medical check UPS. Here is a more detailed breakdown. Eat a balanced diet, focus on whole grains, fruits, vegetables, and lean proteins. Limit processed foods, unhealthy fats, added sugars, and excessive salt. Stay hydrated. Drink plenty of water throughout the day to maintain proper hydration. Get regular exercise. Incorporate daily physical activity and muscle training to improve cardiovascular health and flexibility. Prioritize quality sleep. Establish a healthy sleep routine and create a comfortable, dark sleeping environment. Manage stress. Practice stress-reducing activities like mindfulness, meditation, or spending time in nature to support mental well-being. Limit screen time. Reduce time spent on digital devices to decrease sedentary behavior and give your eyes a break. Nurture positive relationships. Connect with friends, family, and your community to foster social well-being. Practice gratitude. Cultivate a mindset of appreciation for the good things in your life. Maintain oral hygiene. Brush your teeth regularly to keep your gums and teeth healthy. Get regular check UPS. See your doctor for routine check UPS to monitor your health and catch any potential issues early. Copyright 2025 BASuccess.org, BAS. Sharing, research, digitization, conservation of what we have learned. Educational purpose only. Listen, learn, share. All right reserved.